Welcome to this afternoon's third faculty and staff town hall with President Fred Postello and a panel of university leaders. This town hall will be a continuation of the town hall we had on August the 10th. I'm Jeff Fowler, Vice President for Marketing and Communications. On the panel with Dr. Postello are Interim Provost, Dr. Michael Lewis, Vice President for Facilities Management, Michael Lucido, Interim Vice President for Student Development, Dr. Deborah Lowy, Vice President for Human Resources, Mickey Luna, Assistant to the President and Associate Dean of Epidemiology and Biostatistics, Dr. Terry Redman, Vice President for Diversity and Community Engagement, Dr. Jonathan Smith, Staff Advisory Committee Chair, Sue Stevens, and Faculty Senate President and President-elect, Drs. Ruth Evans and Terry Tomasic. As in our previous town halls, this town hall will last approximately 1 hour. The town hall is being recorded today and will be posted on the website for those who did not have an opportunity to join us today. Our panel will be answering first some of the questions that have been submitted ahead of the town hall via the online form. Please note that we have turned off the chat function for security purposes. And if you've not had a chance to ask a question, you can use the Q&A button at the bottom of your screen, and you can submit a question. We have staff who will be monitoring the Q&A throughout this town hall, and we will get to some of those questions as time allows. And now I'll turn it over to Dr. Postello for his opening remarks. He will be followed by Dr. Lewis. Dr. Postello.
Thank you, Mr. Fowler, and thank all of you who are joining us this afternoon. I see that we already have more than 250 people on the Zoom meeting. So it's good to be together and have the opportunity to share some information and answer your questions. Let me start by saying, we've seen what's happened recently. A number of schools that had planned on open have decided, because of what they've seen taking place, not to open. And some of those schools that opened earlier than we did have already either decided to close down or to switch to online learning for some period of time, as is the case of Notre Dame. I want to remind you, we came to this decision after extensive discussions with the expanded ULC, 45 people generally per discussion, representing faculty, staff, students, administration, where we kept saying, what is our mission? What is our values? What are the expectations of our stakeholders? What do those whom we serve expect of us, within the context, obviously, of what is taking place with the virus? What would we anticipate, and what conditions do we need to open and operate safely? I want to share with you a relatively short letter that I received today from a parent that I think sums this all up in terms of the why. And I'll keep it anonymous. This is Dr. Postello. My wife and I dropped off our daughter, gives her name, at SLU on Tuesday, 8/18, to move in and start classes. She arrived late as she tested positive for COVID before moving and had to isolate at home. I can't tell you how excited she was to finally be on campus. We too were thrilled. Thank you very much for having the nerve to have kids on campus and allowing them in-person instruction. Having seen so many other colleges shut down and go to e-learning, we were worried SLU would follow that lead. We are new to SLU, but you have already convinced us of your character by making this difficult but necessary decision. My wife and I both went to, and he names another Jesuit university. Our oldest son is a junior at yet a different Jesuit university. The Jesuit mission speaks to us, and we are thrilled our daughter is continuing her education at a Jesuit university. I think right now, more than ever, the Jesuit heritage is something you can draw strength in as you face the challenges of COVID-19. The Jesuits were called to do the hard work of being missionaries, and they went to where others would not go. They are referred to as God's Marines. In that, They were the first in to spread the good news. I think it is so appropriate that SLU takes up this mantle and finds a way forward with on-campus instruction/living for your students. It is going to be hard. There will be many obstacles along the way, and you may feel like giving up. Please don't! Exclamation point. Bold. You are called in the Jesuit tradition to take the difficult path, to make the choices others don't want to make, and to lead SLU out of the shadow of fear. End of the bolding. SLU's courage in the situation will be something other universities follow. Someone needs to be first. It only makes sense that it is a Jesuit university like SLU. I wish you all the best. We are praying for your continued safety and success. Letter from a dad of a new first-year student who tested positive for COVID-19 and had to move back home. That's why we're doing what we're doing. That letter is because of the hard work you all did to get us to this point. Again, I want to thank you for everything you did over the summer so that we could be prepared to welcome our students back to this campus. Thanks, Jeff.
Thank you, Dr. Priscilla. Dr. Lewis. You're muted.
Thank you. Thanks, Jeff. Let me use my comments to just go over what I'm hearing first with just regard to the what's going on in classrooms and the education part, and I want to do that because I can be short. I'm not hearing much, which is nice. That means things are working. If I'm not hearing things, I was talking to Fred yesterday or the day before, and he asked me what I was hearing because he wasn't hearing much, and you know, and I can name, you know, some small things, you know, things around, you know, maybe certain IT things not working well, but minor, and maybe, you know, some classrooms seating. I'm hearing from, you know, some faculty are still struggling to involve students who are online with, if maybe there's only one or two online, but most of the classes person to person. You know, there's a few, you know, minor things like that. I heard that forgetting that our students were taking class at El Monastero, a lot of people got tickets. Again, if you had told me these were the things that I would be hearing at the end of the first week, I'd have taken all of these. I probably would have added more to the list. This is great. This means it's working. We took 5 months to plan. I've probably said this in one of the previous opening remarks. I've never planned for anything for 5 months. I don't think, not to this level of intensity, and you know, it's been all consuming, and it's and yet you go into the first week like this week, and you don't know if it's gonna actually work, and it's here we are on day 4, and it's with what I've heard, it seems like we're doing a really great job. So I say that, of course, with the backdrop of the email I sent today, which is just to say I'm still nervous. And you saw things that I've heard that are happening, and I'm also, of course, like we all are, well aware of universities that opened on August 10th and did not make it very far into the following week, and so I'm hopeful that we learn from that. I'm hopeful that our students learn from that. You know, I'm hopeful that they see it's not just you know, an old guy telling them what will happen, but it actually happened. You know, they actually can look and see what goes on, and the overwhelming majority of our students are doing everything right. In fact, the overwhelming majority of our students are so great that they're ahead of me. They're doing this, right? To some, you know, I felt the need to write something, but to some extent it's ancillary to what they're doing. Our students are really tremendous, but you know, it's not the overwhelming majority. We need all you know, I hope we get to all. I hope we can, you know, if we're at the end of next week, we can still be open. That's I still think that can be the case. I don't think our story has to be the stories that others have found themselves in, and if, you know, if we can get there, again, what we've been doing with the classroom, with the education in total, there's been some minor hiccups, but it's been a real success. So, and it's been a success, to Fred's point, because of all the work that all of you have put in. So thank you so much for everything that you've done.
Thank you, Mike. At this time, before we get to some of the other questions, I'd like to throw it to Debbie Lowy, because there's a lot of questions about testing and how that's gone. So Debbie, could you give us an overview of how testing has gone?
Happy to. I think I'll talk about testing and move in together, since we made a very late decision to do them together. I think it's fair to say that on the whole, testing went much better than it could have gone, given how late we were in figuring out that we could pull it off. I want to say that I was on site at the testing center every single day for 10 straight days, 12 hours a day, 14 hours a day. I think it's important to know that during that time, what I did was speak to a lot of students and a lot of families and parents. Fred, I think it's fair to say that all of the parents and families I spoke with echoed some version of what that dad wrote to you. Lots of tears, lots of joy at being together. Certainly people are anxious, but the energy of that was pretty helpful. It was particularly helpful on days where we had a 2-hour wait for testing. And folks were pretty patient and gracious about that. Our testing, as you know from the results shared yesterday, our positivity rates were quite low. And I want you to know that I stood in rooms with the students and families where students tested positive. There were a couple of us who spent 10 days doing that, making sure that they felt attended to, making sure that they were getting through to somebody in person at Student Health, stepping out, allowing them to have those private conversations. One thing I want our faculty and staff to know is that almost to a person, those students were deeply anxious. I think that we would assume they had been doing things they weren't supposed to do. And many of them, through their tears, said, I haven't gone very many places. I haven't done very many things. What I did was, and Ashley and others who really were in those rooms, we all tried to assure them that no one would make judgments about how they got to their positive status, that any of us could come into close contact with somebody who was carrying the virus. But it was a small number, and by and large, students and families were very grateful that we invested the time and resources in that testing. And we've tried to be really clear that a negative test result last week is a snapshot in time, right? We've talked about this a lot together, and really encourage students not to see it as free reign and not to assume that it means something about their need to adopt the public health safeguards that we've put in place. The last thing I want to say is just the number of students, student leaders, new students, families who had masks on and were actively distancing. And, you know, occasionally you would see two students who hadn't seen each other in months come up, do a quick hug, and then step back. And so I think we have this balance of, yes, we've heard a few concerning things. We're trying to head those off, as Mike said. I think it is fair to say that our students are really eager to make it work. And on the whole, doing what we want them to do. And so I saw a lot of that in the testing and move-in process last week.
Thank you, Debbie. I'd also like to throw it to Terry Redmond to get her take on how testing has gone.
Thanks, Jeff. Testing was exceeded my expectations in terms of what the results showed. Our test positivity rate was lower than what we're seeing locally in St. Louis, both in St. Louis City and in St. Louis County. So that gives me great confidence that the vast majority of asymptomatic carriers were identified through our early testing and are now in isolation. So we have essentially created the safest space possible for our on-campus residents. So it's a great start to the fall semester.
Terry, if you can stay with us for the next question. You have spoken previously about our contact tracing process and the university's plan, but the question is, now that our contact tracers are active, can you speak a little more about that process and what we have learned?
Sure. So the contact tracing team is fully formed. They're up and running. They have already done some contact tracing with a couple of infected individuals. And what we've found so far is that the data is kind of reflecting what would be expected, that most of the individuals, most of the close contacts are roommates or significant others. So that's what we expect, that we see a lot of close contacts happening with individuals who live together and or with significant others. The contact tracing team has identified a few small clusters of what I would call social groups, where there were some groups of students who were sharing meals together and or forming study groups together and not wearing their masks. So we have raised some awareness about that to let the students know that that does qualify them as being close contacts, so that we hope to not see that moving forward.
Thank you, Terry. We received several questions in the forum about why we made testing mandatory for students living on campus and only optional for those who live off of campus. Similarly, some have asked if we plan to make testing mandatory for our faculty and staff. I've asked President Postello, would you like to speak to this before I ask Terry to address the reason behind our decision to mandate testing for residential students?
Sure, I'd like to say a few words on that, and then happy to turn it over to Terry. So in mid-June, we had a working group that had faculty, students, and staff on it, and they identified the definitive public health safeguards that must be in place if we were going to open. The mass, at that time, the mass testing of asymptomatic students was not on the list of things we thought we must do. There were a number of reasons for this, including the American College Health Association and the Center for Infectious Disease Research and Policy at the University of Minnesota, we followed them closely, concluded that large-scale testing of asymptomatic students was not going to provide any significant public health benefit. At that time, the infection rate of young people was low. COVID tests were in short supply. And even if you could find tests, labs couldn't turn the test results around in any sort of reasonable period of time. And we know that here. We talked to a number of people who, if they were able to get tested, waited 7, 10, 14 days for testing. As you know, we do not have a national strategy around this. We don't have coordination around it. Various regions of the country go through periods where they can't get test kits or supplies. And this has been a problem and continues to be a problem, and we're all competing with each other for these. The working group did say that the university should revisit this if the circumstances changed. And in mid-July, the circumstances did in fact change. The infection rate among young people started to spike locally and nationally. So many were now showing, even though they weren't showing symptoms, the positivity rate among people in the 10 to 29-year-old group, 20 to 29, 30 to 39 group went up. So this elevated our concern. And so we continue to look at the data, and we started thinking about what does it mean now to bring thousands of young people back to campus? What might the public health risk be to our campus and to our region? So concurrently, Renee Jonas, who's our director of the Student Health Center, was able to identify a company that could deploy a team here and the testing devices with a rapid test system that could give us the results in 15 minutes. So we decided that we would in fact test all of our residential students, identify the positive cases, not allow them to move in, and in fact isolate them. So this would reduce any immediate community spread on and off campus. Now we did that about 4 or 5 days before the students started arriving. It was an incredibly intense effort among a number of people, including virtually all the staff in the president's office, at the head of the student development office, provost office, and others. A tremendous effort to put this together in a relatively short time, but we were able to do so. In the end, we tested approximately 3,500 students. We sent out a memo on this. 22 were positive. That's an infection rate of 0.63%. As Terry said, that's lower than what we were expecting, which was 1 to 2%. So we were very pleased by that. We've also tested a little more than over 750 off-campus students. There we identified 13 positives, or a 1.7% infection rate. Now, these numbers do not include students who have previously had COVID, are over it, no longer infectious, but also tested positive. Now, this rate among our returning students is higher, 1.7% than the 0.63%, due probably to self-selection. We required it of our residential students. We made it optional for the off-campus students, some of whom came in because they feared that they had been exposed or were showing symptoms. We'll put aside the matter that we encouraged them to take a different path if that was the case, but we tested them nonetheless. So on the faculty staff side, we have offered testing for those who show COVID symptoms since January. And for those faculty and staff who are on campus right now, actively practicing our public health protocols, we believe there's a lower risk of catching the infection or spreading the infection, as is the case with the vast majority of our students. Dr. Wilmot and I had a conversation this morning. He informed me that we currently have no positive cases among our medical faculty or our medical students. And furthermore, we've not had a single positive case among our residents in over a month. Now, keep in mind that some of those residents and some of those physicians are in regular contact, are treating COVID positive patients. So this clearly demonstrates the effectiveness of the mitigation practices that we're practicing in SLU care. So I believe as long as we remain vigilant, it is not evident to me that we would need to conduct mass testing of asymptomatic staff and faculty. Those who believe that they have been in close contact, unprotected contact with COVID positive persons, or have symptoms should contact employee health. Otherwise, positivity rates should be extremely low among those groups. Thanks, Jeff. Should we turn it over to Terry?
Yeah, Terry, let me begin by posing to you a question I've heard many times and that Dr. Postello talked about, is that how someone who has had COVID-19 has isolated and is now no longer infectious, why they would still test positive later on?
Sure. So we're still learning about SARS-CoV-2, but what we're finding is that some individuals continue to shed virus for longer periods of time, but that their period of being contagious only lasts up to 10 days or up to 20 days if somebody is severely immunocompromised. But for the vast majority of individuals, after a period of 10 days, they are no longer contagious, even though some will continue to shed virus. The amount of virus that they're shedding is enough to result in a positive lab test, but not enough to actually spread disease to someone else.
All right, Terry, thank you very much. This next question is from Mickey Luna. It mirrors a question we've had in a previous town hall, but it's continued to be asked. The question is, what will the university do to support employees whose children's schools have moved to entirely virtual instruction?
Sure. Thanks, Jeff. So to start, I think it's always worth restating that there really is no playbook for this. So this is an unprecedented situation for our society, which simply was not built to accommodate 60% of our school districts sending kids home. With that said, I continue to be amazed and really impressed with how our SLU community has adapted to this. We continue to see people who've come up with creative solutions to solve for these problems. They've made adjustments in schedules, work together to come up with ways to make it work. And so I think the rest of the community is grateful for those efforts. Not to say that every situation has an easy solution, but where those are available, I know people are working on it. But just to go back to then, what are some of the things that we're doing? I think first and foremost, as has been stated many times, any employee that can work from home should continue to do so. That helps us reduce our campus density, but also provides our employees whose children are learning virtually the ability to be home with them. Now we recognize, many of us who have tried to do this, that working with children attending school at home is not easy. And so depending upon the age of the children, maybe those with older kids, it's a little bit easier, but for those with younger children, it can be challenging and frustrating. We have really pressured, or not pressured, but maybe encouraged and continue to emphasize to our supervisors the absolute necessity for being creative and flexible in how we work in this situation. That may mean working alternate schedules, making adjustments to how we accommodate parents who are helping their children, but also trying to get the work done at the same time. It really requires a lot of communication and regular check-ins with supervisors and employees to work together to find those solutions. And that's the best answer we can give in those situations, but we're seeing it work. A slightly more challenging situation arises for those essential employees who must come to campus, particularly in our clinical settings, but also those who are working closely with students. Some people will have access to easy solutions, and we see that. They may have family members or friends who can help. Others do not have those types of solutions available. And so we're seeing different departments come up with creative solutions once again to solve for that. Sometimes employees getting together and taking turns watching each other's kids, helping each other in those situations is one example of what we've seen some departments do. If you have an idea for how you address this and you're not sure it will work, we encourage you to work with your supervisor or reach out to your human resources consultant to talk about it and see if we can figure out an easy solution. I also want to remind everyone that the human resources team is continuously looking for and identifying resources and updating those resources on the One SLU webpage. So there are resources in the community that have been developed in response to this situation that can provide families assistance, particularly those families who are essential employees and need to come to work. So we encourage you to, in this situation, in that scenario, to look at those pages and look for those resources. I'll also let you know that we're actively exploring other programs and options that could be available to support our people in this situation, and we will continue to communicate as we learn more about those options. The last point I just want to make is it's really important for everyone to come together to identify the solutions. So we're not unique in dealing with this. It's not solely the responsibility of a supervisor to come up with a solution. It's not solely the responsibility of our faculty and staff to do it. We really have to work together, and all are empowered to do that.
Thank you, Mickey. And to follow up on Mickey's point, also the back to SLU pages are being constantly updated, really on a daily basis, with new Q&A as questions come in. So please check back frequently to that page as well, because there's new information being posted almost on a daily basis. Mike Lewis, do you want to speak to the faculty side of this question we just had?
Yeah, sure. The faculty should reach out to their chairs and deans, and we've encouraged the chairs and deans to work with faculty to be flexible. I've heard from faculty who have been able to move their courses online at a relatively late point in time because they finally heard about their school district's plans. So I mean, I know it's happening, and I'm hopeful that I haven't heard from people that it's not happening. So my hope is that we are able to, at least the faculty are able to just work with their chairs and deans to make for this accommodation, that the courses can be either moved online or moved into the evening face to face, and therefore allow the faculty member with the flexibility they need to accommodate their childcare needs. So, thanks.
Thank you, Mike. Questions come in from the Q&A about the possibility of a dashboard that could be put online for members of the SLU community and also external stakeholders, could monitor COVID testing as we proceed throughout the semester. I can answer part of that. The university website reports to me, and we are working up really a module to be able to do that. I know that Eric Armbrecht, who does work with the president's office, is working on the data collection part of that, so that we make sure we have the most accurate data, and then a way to sync the two so it could be updated on, let's say, a weekly basis, and you could see how many total cases we've had, and then how many per week that we've had. Terry, do you want to comment any more about that?
Only that we're still discussing exactly which data points we plan to share publicly. But as we talked at one of the earlier town hall meetings, there will be a large number of variables that we will be looking at and evaluating on a regular basis. We're just trying to decide what to share publicly at this point.
Great. Dr. Costello.
Yeah, thanks, Jeff. No, we're committed to doing that. It's a matter of working it out. We shared, once we had it, we're confident we had the data on the testing positives for all the incoming students who were with us. We shared that. I just shared with you the non-resident student testing results. So we're committed to doing it. It's a matter of getting the time and bandwidth and making the decisions as to what should go into it.
Thank you, Dr. Costello. This next question came in yesterday from a member of the faculty, and I think which Terry can answer. Could you please grant permission to in-person students and faculty to take sips of water while in class? Is there a way to do this safely? It's hard to talk through a mask without becoming hoarse.
Sure. So moving your mask aside to take a quick drink is fine. Remember, the definition of a close contact or exposure is 15 minutes within 6 feet of another individual when you're not wearing a mask. So simply moving your mask to take a quick drink and then putting your mask back in place is not going to be an infection risk to those around you.
Great, thank you, Terry. Debbie Loy, we have a student-related question that came in yesterday. Are we certain that freshmen are doing all right? I'm concerned because I had 2 come to me after class this week and tell me they feel isolated and have been crying because they only know their roommate because they are not allowed to meet with anyone else. I am starting to really wonder if this is better than not having them on campus. What can faculty and staff do to help support our students who feel this way?
Thanks. That's a good question. One thing to say is we can never say with certainty that our first year students are doing okay, right? There are a number of adjustment challenges that always come up, particularly in these first couple of weeks before they have really begun to find their people or engage with folks on their floor or get engaged in student organizations. So our brand new students haven't yet learned about student organizations. The SLU Fair will be virtual and it happens this coming weekend. So there will be opportunities for them to begin to see organizations and groups that they might want to get engaged with. So that's one answer. It's not nearly satisfying, I understand. So here are a few things I would say to you. It is not entirely true they can't meet in person. Our Oriflamme leaders have had small group meetings. They take them outdoors. There are 8 or 9 of them. They can sit in a big circle spread out. They are doing some things in person. With following protocols, right? There also are RAs who are organizing virtual and outdoor socially distanced opportunities for students to meet others on their floor. A lot I think is partly just the moment we're in the term, where they have not yet had exposure to a lot of other opportunities to connect. And so one key thing to know is that as we work on the interim policy on events and meetings, we've been doing a lot of work to understand what are the exceptions that are going to have to be approved, right? There are going to be very mission-centric activities like Mass that will happen in person. We can't have zero things happening in person, just as we have classes happening in person, right? So I think we have to take each organization, each event, each gathering, each thing on its own terms, and really take Ignatian valuing of context into consideration. I think one of the things that I have a group working on is what are the criteria by which we would determine which student organizations would do things in person, and what would that mean, and what would they have to demonstrate and prove is in place in order for that to happen. Lots of things are happening outdoors. I think that's important to say. We're trying to balance the physical health and safety and the emotional and mental health and safety. So the question about what faculty and staff can do, I think one is virtual outreach, right? So opportunities to have more drop-in sessions on Zoom, helping students in a class connect to each other. So maybe even helping students find study group partners. Maybe that's a thing you wouldn't do in a normal time, but it's an opportunity for you to help them sort of build some connections. The other things I think you can do are encourage students in those situations to reach out. And some key places to reach out to would be, for me, and I'm happy to put these in the chat when I'm done speaking, the Dean of Students Office, which is a central hub of care and concern and can connect students. I think they should be encouraged to reach out to their Oriflamme leader and or their RA, because those are people who are very invested in a one-on-one, sit outside, have a tea, right? Find some ways to build community. Campus ministry, the counseling center, and the student involvement center, and the cross-cultural center. So I'm really thinking a lot about how students from marginalized or minoritized populations on our campus are even more isolated in a moment like this. And so the kinds of connections we need to be sure they know how to find and then foster for them is even more important than it would normally be in a normal time of just being a person who is in an identity group where you don't see that many people who look like you, right? And so I think encouraging students to reach out and ask for support and help, and just encouraging them to connect with their RA or their Oriflamme leader. All of those student leaders are very ready to make some connections and to introduce students to one another on a floor. But I do think after the SLU fair, the virtual SLU fair that's happening this weekend, our students are going to have a lot more information about groups they can connect to. That's going to make a big difference. And I don't want you to think there are zero things happening in person. We're working hard to understand what would be safe to do in person. And I just have to say, we can't expect them to stay on campus and do nothing when things off campus might be in person and fun. So if we really want them not to do things off campus we don't want them to do, we have to be really intentional about designed opportunities that have safety built in and connection built in. And so those are some things that we're thinking really carefully about.
Thank you, Debbie. Back to the email message that Mike Lewis sent out today. We have a question from the Q&A. Mike, what can we learn from Notre Dame and University of North Carolina?
I saw that question. That this job would be easier without students. Is that a good answer? No, I love our students. I think Debbie, the first thing that came to my mind when I saw that, actually Debbie just answered it. I think that we came up with a set of guidelines around, say, events and clubs and so forth that as Debbie has said, she's thinking of how to make that happen, right? It's there, you know, if there's nothing to do on campus, they're going to go off campus. Students will go off campus, right there. And so we need to, that is something that I think to learn, right? I also I mean, I don't know if this comes into the learn category, but I think there is, to some extent, you know, just the fortune that we have in going after them, right? So that our students can see the outcome, right? It's, as I said in my opening remarks, it's one thing for me to say it. It's another thing, or for any of us to say, it's another thing for them to see it actually happening in real time. And so that is also, again, I don't know if that's a learn part, but you know, it allowed, you know, as far as learning goes, it allowed me to send a message today, and it also allowed our students, which is, and this is probably more impactful and more important, our students actually sent a message to their peers to self-regulate. So those, you know, I guess that, you know, if I took a more forest level view of it, what I think that I'm learning that I would take away from this is that this is going to be very fluid from week to week. Problems will come up, and we're going to have to adjust quickly, which means a lot of work. But that's fine. You know, I'm invested in this. We're all invested in this. We want to see this succeed. So I would say, Jeff, that's the biggest thing. We, you know, keep watching what other universities are doing. Keep watching what's happening on our campus, and trying to adapt, and hopefully, you know, again, having a little bit of good fortune doesn't hurt either. But we can, you know, this is very fluid. We thought we knew, for instance, what we were going to do with events and clubs, and effectively, Debbie just told you we're already rethinking it. That's what we're learning, that we're going to have to continually reconsider and rethink what we're how we're going to approach this.
Thank you, Mike. Debbie, you wanted to add something else?
Yeah, I just wanted to add one thought. So when we were deciding whether or not to test students back in June, back in July, we were weighing the challenge of a bunch of students with negative test results, and would that give them a false sense of security? One lesson I think our students are learning is that some of them are in fact testing positive. And so there is a benefit that comes from them knowing someone who tests positive. They figure out it could be them. They figure out it could have been them. It was a thing they were at. Now they have to quarantine. I don't know that they believed it could be them. And now I think they do. And so our challenge, I think, is to connect that dot for them, that a positive case for them could have the ripple effect of shutting down the institution. I don't think that level of extension of consequence is necessarily how they think about it. But I think they are able to think about it that way when they see those other institutions. So I think, Mike, your point about they went, you know, they happened before us, I think that is a benefit. So that, coupled with the knowledge that their peers will in fact test positive, I actually think there's a good lesson in that for our students. And I think they're aware of that in a different way.
Thank you, Debbie. We're going to go to another question. Terry, this one will be for you. It's a long question, but it came in through the Q&A. How will supervisors of student employees be notified if one of their student employees tests positive for COVID or is in contact with a known positive? Will contact tracing be done in places such as Pius Library and Simon Rec if a student employee tests positive or has been in contact with a positive case? In the first week of classes, Pius Library has had 1,200 people in the building each day, 2,600 on the first day of classes. How will contact tracing even be possible in such a public and heavily trafficked space?
So that's a great question. So what you have to remember about contact tracing is the process actually works exactly the same regardless of the individual. You have a conversation with that person about with whom they've had close contact during the time during which they've been contagious, which is generally speaking 2 days before their symptoms started or 2 days before they tested positive if they're asymptomatic. Then you have to go to the definition of a close contact, which means that you have to have been or spent more than 15 minutes within 6 feet of an individual without wearing masks. So what that means is that simply being in Pius Library together does not constitute a close contact. So we would not need to quarantine everyone who had been in the library at the same time as an infected student or employee. And then in terms of the reporting aspect, individuals who are close contacts of an infected person are told that they have had close contact with an infected individual and told that they need to quarantine, but they're not told that individual's name. So if a student is your employee, they would contact you to say, I'm not able to come to work, but they don't have to tell you the reason why. We encourage them to. We encourage students who test positive to let their instructors know and to let their employers know, but that is up to them to make that decision.
President Bustelo, we've had a question come in that you might want to talk about first, as well as Debbie Lowy. A staff member asks, what are employees expected to do when they see people, namely students, around campus not socially distancing from one another?
Yeah, thanks, Jeff. I will tell you what I do and what I recommend you do, which is to ask them to follow the protocols. So as I walk campus, I've seen some students, for example, who were closer together than they should have been, and I asked them to increase the distance. I've talked to others who have done the same thing, and I've heard generally the same thing I experienced. You get an apology. Certainly, I sometimes think people don't know what 6 feet is. And as soon as you tell them, I found compliance. So I think you just gently remind them that whatever they're violating it, and ask them to please get in compliance. And I think that you're very likely to find that they will follow the rules.
Debbie?
Yeah, I just would add, I think that's been my experience too, Fred. I was in the testing center with thousands of people for 10 straight days, right? So over 10 straight days. And students would come in little clusters and we would say, could you spread out, right? The muscle memory, as I said to students this week, is to be close. I've had a number of students and recent graduates say, this is a huggy culture for students. Like we're accustomed to that. I will say there are a couple of different things. Sometimes students will say, we live together. So, right, if they live together, they can have their mask off in their room. So then being together on the quad, it's a little weird for them that we want them to spread out. We're still asking them to do it, right? We're still trying to make sure everybody is in that space, kind of spread out. But in my experience so far, I have really just not, I decided I wouldn't shy away from saying, hello, friend, do you have a mask? Or I see that it's not over your nose. My public health colleagues tell me that you're not really wearing it if it's not over your nose, right? So that kind of gentle nudging, gentle encouraging, and I'm not gonna lie to you, in my office, I don't have to have a mask on if I go out in the hallway to go to the bathroom. It has happened once that I forgot, right? It's not my muscle memory yet. And so I think extending that grace, I think that's, and I've watched our students do that, asking people, spread out, please, right? It's that definition of a close contact that concerns me most. And so when I see a couple of students who haven't seen each other since February, run up, give a quick hug, and then step back, I am not worried about that. They have their mask on. It was a quick moment. They step back. It's the sitting together piled at a picnic table, everyone eating, everyone mask off. I just think we have to be willing to be sweet and sometimes funny, but serious about spread it out, put your mask on. I think our students are doing that. We're going to have the occasional student who is recalcitrant and refuses. Certainly we have heard that. There is a conduct process. There are community standards that include our public health safeguards. There are processes in place for any kind of violation of community standards, and those processes are working as we want them to. And so I don't want you to think that there have been no reports or that nothing is happening to students when there are reports. There are certainly processes in place for when they are needed to help a student get back on track and to be really mindful of their impact to community.
Thank you, Debbie. This next question is also for Dr. Bustelo, and I think Mickey Luna may also want to speak to this. Dr. Bustelo, can you speak to the financial impact COVID-19 has had on the university? In April, there was an email that outlined an estimated $80 million loss. There have been news stories of significant layoffs and pay cuts at other universities.
Yeah, I'll try to be as succinct as possible and then let Mickey add to it. So I'll talk first about last year, fiscal year 20, and then the year we're now in, fiscal year 21. fiscal year 20 in May, when we met with the Board of Trustees, we were projecting a $22 million deficit to end the year. In February, we were projecting that we'd be break even or maybe have a slight positive. That's with the increased endowment spend. In July, when we held a special meeting of the board, just to update them, we thought that that 22 million deficit had improved to 15 million. And Mr. Heimberger reported at the ULC recently that he now thinks that as we're getting close to closing the books, it's probably been reduced to about a $12 million deficit. Still a deficit, not what we would like, still has the increased endowment spend, but better. Why? David gave two primary reasons. One, SLU Care had a very good June, better than we projected. And secondly, that we are slower in terms of filling open positions which have been authorized to hire. And so there are salary in those lines, and we had that saving. So we'll probably end last year, not quite finalized close, but close to a $12 million deficit. Going into this year, we're projecting a substantial deficit, which is why we took the mitigation efforts that you know of with respect to not giving a salary increase, suspending the 403B contributions, salary reductions among the president, vice presidents, deans, salary reductions in SLU Care and so forth. It's very difficult to say because we're so early in the term. I think that if everything stays the way it is, given the number of students that we have in the residence halls, the number of students who have returned, and our retention rate at this point is very good. The number of students we've attracted, now clearly we don't have the numbers in the entering class close to what we would have projected in February, but they're pretty close to what we were saying when we were projecting what it might be in the new reality. With the mitigation efforts we have, we'll probably be about all right. It's tough to guess. If we have to move to all online, if we have to close the residence halls, not that we're anticipating that or want to do it, but that would have a substantial negative impact on the bottom line. We're only in the first week of classes. I don't think we'll have a really good sense of this until, one, we get to census date in a few weeks, and secondly, we see how we're going to be able to continue to operate. So at this very early, very preliminary, very rough time, I think our best guess is that with the reductions we've already employed, we'll probably be on track for being where we thought we would be at the end of the year, but it is way too early to start making any projections at all in terms of what the final retention will be, new students will be, net tuition revenue will be, auxiliary revenue would be. It's just very, very early to project that. Mickey, do you want to add anything to that?
No, Fred, I think that's what you shared is exactly what I would have shared as well.
The next question is for Mike Lewis and Debbie Lowy. This came from a faculty member. Can I expect to see some students switching between being in person and online in my classes?
Yes. You probably want more detail than that. Yes, I would. My expectation is that students will. Well, we know some students have tested positive. More will probably test positive. Hopefully, we keep it to a low number and it doesn't get out of hand for us. But when they test positive, they will quarantine, possibly have to isolate if they test positive. They'll also then have, for those who by the contact tracers have deemed to be in close contact, they'll have to quarantine. So between quarantine and isolation, again, those who have tested positive will have to isolate. Those who were possibly exposed will have to quarantine until they learn whether they were positive or negative. In both cases, that means that they'll more than likely attend online. If they're so sick that they cannot attend online, well, that's a different story. But most of them, I think, would be able to attend online, and so that's what you should expect. So that will certainly. I mean, at this point, I would say it's probably manifested itself in students not starting with you, but maybe they've started to show up. So Fred noted a student who came to campus on Tuesday. So that student might have missed the first few classes. So they would have started like, well, and so at this point it's probably manifesting itself in students starting late. But I do think over time, if we can hopefully keep campus open, this should manifest itself in students going online and then coming back, and the faculty may not know, probably will not know that it's because they're in isolation or quarantine. They don't have to share that.
Thank you, Mike.
Yeah.
You want to add?
Yeah, I would just add, I think, you know, I've assured the students who tested positive that you're not going to judge them or make assumptions. And I think we have to work really hard at that, because while we have students doing things they shouldn't, we also know that people will test positive trying to do all the things they should. So that's one category. I also think when we think about the numbers, so I was thinking about this with reporting positive cases. At any moment, the number reported is slightly out of sync with who is positive on that day. Right? So we have students who tested positive 10 days ago and are now out of isolation. They shouldn't continue to count against us in our mindset about positives. Similarly, we should expect to see more students in quarantine than we have in isolation, right? Any single student in isolation has at least probably a roommate, maybe a couple of roommates. There might be 3 or 4 or 10 people in quarantine as a result of that positive. So A, you can't make assumptions about why they're not with you, and B, there will be students who need to come and go from the in-person classroom for a variety of reasons, and 2 of the big ones are quarantine and isolation. And so I think it's hard. We have to come at that process, contact tracing, testing, and quarantine and isolation, in ways that don't leave students feeling they're being penalized for telling the truth and then going into quarantine and isolation. Because if we do that, we'll disincentivize their telling the truth, and they'll just come to class when they shouldn't. So it's this thing where it's a balance, and we have to try to be as flexible as we can. And you know me, I'm on the teaching side in my heart and in my head, so I get how complicated and messy that is. And I just appreciate the grace that everyone is showing our students. And I think they're trying really hard to stay as engaged as they can, because they don't want to be missing class. That's the reality, right? They know that puts them behind. And so it's a balancing act.
Thank you, Debbie. Dr. Pistella, we're getting close to the top of the hour. I don't know if you'd like to continue taking questions, or if you'd like to make closing remarks.
Yeah, why don't I go to closing remarks, Jeff, because I see we're very close. I want to say a couple words. I want to turn it over to Jonathan, who ended our first town hall. This is now our third, and I think did a terrific job. So let me just say, as we come to the end, and we want to respect your time and keep these town halls to the hour as we said we would, that none of us in higher education have been through this before, obviously, and each school and college is trying to figure this out and making the best decisions they can, all things considered, taking account of many, many different things, from mission to the population they serve to the conditions of the virus and so forth. And we're all watching each other. I mean, we're watching those schools that went before us, Notre Dame, UNC, those who started a week or more before, and others are watching us. I've talked to Andrew Martin a couple times in recent weeks, and he said, we're watching you. We're very interested in learning from you. We're all trying to learn from each other. The Jesuit presidents are having regular calls. In the past, in normal times, we get together twice a year. Now we're having calls every week or every other week. And again, it's what are you doing? Why? What are you hearing? Sharing information. So uncharted territories is often said, but we couldn't be doing as well as we're doing, again, without the support of all of you. So I want to thank you, and let me turn it over to Dr. Smith for some concluding comments.
Thanks, Fred, and thank you to all of my fellow Billikens out there, all of you who decided to attend today's town hall. One of the things that's on my mind really picks up where you just ended, Fred. I have been thinking a little bit about James Baldwin's The Fire Next Time, and for many who know that book, it's written in 1963, and it's about Baldwin's description of some dire race statistics and dire race realities in America in 1963. And so he you read through the entire text, and it feels in most places really pessimistic, because he's urging us not to live with delusions about our reality. But just in that last paragraph, he says, he has a sentence that for me is just absolutely powerful and profound. He says, everything now we must assume is in our hands. We have no right to assume otherwise. So at the end of a clear, often pessimistic assessment, James Baldwin stepped up to the plate and said, everything is in our hands and we have no right to assume otherwise. All of us who are in leadership want to be called into accountability, but we want to also call our entire community into accountability. Faculty, staff, students, trustees, wherever you are. The only way we will navigate out of this successfully in any reasonable amount of time is if each one of us assumes that I have a responsibility, I have a level of accountability, and I will do what I can do to bring us out of this successfully. I'm teaching online this semester, and it breaks my heart. I'm sitting here in my kitchen where I've been sitting since March, and seeing all of you, all of my friends and colleagues and students and all of you this way. And I want to get back to campus. I tell my students that in my class. It's like, I need you to wear your mask and to do the distancing, because I want to get back to campus. And I assume that I have some real responsibility to bear in that. And I hope that you, every one of you, along with me, along with all of us, assume that we have some responsibility towards that. And I had an opportunity to speak to our athletes at our athletic division at the beginning of the week, and we had just found out that North Carolina had shut down. And I was unabashedly competitive, feeling unabashedly competitive at the moment. And I want us all to feel competitive. I want to beat Carolina, beat Notre Dame, beat all of those schools that we may not beat in basketball or football or any other thing. But let's be competitive about this, because if we win this, it will be good not only for St. Louis University, but for the city, the region, and our nation. So go Billikens.
Thank you very much, Jonathan. Thank you, Dr. Costello. And thanks to all of our panelists for joining us today, and all of you who joined us virtually for this town hall. I know that there are still questions out there that remain. Please know that you can send questions. You will get a response to pandemic@slu.edu. The questions are helping inform updates that are being made to the community and to the Back to SLU webpage. So please keep an eye out there for additional updates. Again, thank you everyone, and have a good and safe evening.